And the dad was kind of questioning me like, why are you collecting her urine? She's here for back pain. Hey guys, welcome back to my channel. My name is Lori. If you are new here, I am a family nurse practitioner, and in today's video I'm going to be talking with you guys about 10 of the most common illnesses that I see in the urgent care space. Now, if you are new here, I recently started working in urgent care space 6 months ago. I recently did a video about my 6 months update. If you haven't seen the video, tap right here and you will be direct linked to the video. I will also put the playlist down in the description box about my urgent care journey from week 1 all the way up to 6 months period. So let's jump right into these illnesses. Number 1, sinusitis. Let's put it in air quotes, because sinusitis is really your sinuses are inflamed. Doesn't necessarily mean that it's a bacterial infection and you need antibiotics. Of course, you're doing your physical assessment on the patient. You are making sure that you're palpating over the nasal sinuses. There's a couple of other things that you do. I feel like people research and Google these things though, and they know what to say, but that's neither here nor there. Symptoms that are only 2 days, 1 day, it's not coinciding with a bacterial sinus infection, right? Some patients seriously do have a bacterial sinus infection and need to be started on antibiotics. A lot of times you should just advise your patients to take their antihistamine, especially now that the weather is changing, their Zyrtex, their Claritin, Flonase to the nose if they can do that, if they have the nasal congestion. And sometimes I will give a little bit of steroid because your sinuses are inflamed, it's not bacterial. You know, you can have that help to relax the sinuses. Second thing that I get a lot in urgent care is for STD testing. Urgent care setting, you can check for gonorrhea, chlamydia, trichomonas through the urine, so you would have to send that to the lab. You can also do vaginal swab and send it to see if it's bacterial vaginosis or yeast infection. And what I typically do is, if the patient state that their partner tested positive, they're not having any symptoms, I will go ahead and give them the Rocephin injection, because the urgent care space, most of them have the Rocephin injection. So your Rocephin is for gonorrhea. So I'll give the Rocephin injection and then I'll wait for the cultures from the others and then go from there. The next thing that patient comes in a lot for is abdominal pain, and abdominal pain can mean a lot of different things. Your abdomen is so complex, so abdominal workup in an urgent care setting, for me, especially when you look at somebody's age, sometimes it's not even worth it and make any sense, but you gotta do what you gotta do. So anytime somebody complains about abdominal pain or back pain, I always collect a urine on them and do a urinalysis. I had a patient actually that only symptoms was back pain, and I collected the urine, and the dad was kind of questioning me like, why are you collecting her urine? She's here for back pain. I'm explaining to him why I want the urine. Like, I'm collecting the urine because back pain can mean a urinary tract infection. And he was like, well, she has no other symptoms. I'm like, it still can be a urinary tract infection. And guess what? She did have a UTI, ding, ding, ding. That was her only symptoms. And he actually didn't believe it. He was like, I'll take her to her primary. I said, okay. You know, abdominal pain can be constipation. It can mean STD if, you know, it's gone far long enough. It can mean UTI. It can mean that patient is having a miscarriage. I had a patient with abdominal pain and she did not know she was pregnant, and I said, I'm going to collect your urine, I'm going to do a UA, I'm going to do a pregnancy test. Pregnancy test was positive. She didn't know she was pregnant, and I had to send her to the emergency department. It's just a lot with abdominal pain. You just have to hear the symptoms, do your due diligence, and then go from there. Abdominal x-ray a lot of time is a waste of time. I'm gonna tell you this, especially when you look at some of the symptoms that they complain about. I do utilize the x-ray to do a KUB or different things like that. Diagnose a lot of constipation in kids. Make sure that it's not appendicitis when kids come in there and they complain about abdominal pain. Next thing that patient comes for all the time, this is kind of wrapped up in that, is UTI, right? But patient will come and say, I have a UTI. And I said, okay, what kind of symptoms are you having? I know I have a UTI, but then they don't want to elaborate and tell you what symptoms they're having. And you do their urine and it's clean as a whistle. No bacteria, no blood, no protein, no nothing in the urine. And then when you tell them that, they're like, well, that's weird. The next thing that I get a lot is fractures. I put that in air quotes because everybody thinks that they have broken a bone. I've been in urgent care for 6 months, and for 6 months I have probably ordered 1,500 x-rays. Like, I'm not kidding you. I order a lot of x-rays because patients come to the urgent care for x-ray because they really think that they've broken a bone. And out of all that x-rays, I have truly only had less than 10, probably 5, honestly, that was a fracture. Like, and it's always in kids. So with kids, I will automatically always try to do an x-ray for kids, because little kids, they're growing and they can have hairline fractures. You know, a lot of times you fall, you twisted your ankle, x-ray come, and there is, you know, nothing broken. You treat that like as a sprain if there's swelling there. So your typical RICE. So what is RICE? Rest, ice, compress, elevate. So I'll give them a ACE wrap and all of that. And a lot of times patients really do this, and then they'll tell you, I need you to give me 4 days off of work. Okay, that's not, like, I don't give you 4 days off of work. You know what I mean? Like, your bones is not broken. But I get, next thing they come for a lot is cough. We know, especially the season is changing, everybody's kind of coughing. I understand that a cough can linger for 3 months, you know. It's annoying. Cough can mean so many things. Patients smoke. They have a history of asthma, and the cough is because of the bronchospasm that's going on. You kind of have to find out what is underlying and what's going on and why they're coughing. Of course, I utilize my x-ray machine if I think that, oh, maybe I'm thinking there could be a little bit of pneumonia going on. Like, I had an older gentleman that came in and he said he was coughing. His coughing was only for 2 days. But then he was like, I'm coughing, and then this morning I noticed that it was kind of brown. So I said, are you coughing up blood? And he's like, I don't know. So I'm like, all right, I'm gonna do an x-ray. Sure enough, he had pneumonia, and his cough was only for 2 days. So you just have to make sure that you're kind of listening to the symptoms and then go from there with your best judgment. And then cough, you know, it's over the counter cough medication. Once again, weather is changing, you need to do your antihistamine. Everybody says my sinuses don't bother me, but then you look in their ears and there's fluid building all the way up in their ears because their sinuses are draining and backing up in their ears. Like, I don't have sinus issues, I just need a Z-Pack. Next thing that I get a lot is sore throat. I have a sore throat. The sore throat is for 2 days, and I need you to give me something for the sore throat. We have to rule out why the sore throat is going on. And I'm like, once again, patients don't like to hear this, but we got to rule it out, right? Sore throat can mean COVID. I had a patient who had sore throat, and I said, how is the sore throat? She said, my throat is really, really sore for 2 days. I have a slight cough, but not really. And I was like, well, I need to rule these things out. She was refusing to do a COVID test. And I'm like, I don't have COVID, blah, 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 blah. So I said, well, I need to rule out COVID before I can give you anything, because all I'm going to tell you to do is supportive care. And what supportive care at home means, your home remedies. Warm water, put salt in it, gargle. So she reluctantly did the COVID test, and she had COVID. Positive for COVID. So sore throat can mean many things. When it comes on to children, even adults, depending, it's quick to do a strep test in office. Parents always think that their kids have strep anyways, so I automatically just do a strep. I have been there for 6 months. I have only had 3 positive strep tests on that rapid strep. And for me, I just always go ahead and send their throat cultures to the lab, and none of them has ever came back positive. Because the 3 people that I did have a positive in-house, I didn't bother sending their throat culture. The strep in-house is positive. I treat them for strep throat. But all the other folks that they're swearing up and down that they have strep, I'm like, well, the lab is going to culture it and it's going to tell me if you have strep or not. They're never ever positive in my experience so far. Let me say this though, for sore throat, it can be tonsillitis and you need to put them on antibiotics. So the tonsils can be very swollen. You can have exudates on them, they're coughing, they're telling you that their throat is sore. It's to the point where they can't swallow or eat. It's painful to eat because the tonsils is looking like that. They have a fever. At that point, all these boxes are checked off. I put them on antibiotics. Also, remember that tonsillitis sometimes can mimic mono. So if the tonsils are swollen and you have the exudates look so, it's almost look, not, I want to say necrosis, but no, it's like the black, do a mono screen as well in your office, okay? The next thing, oh, this video, I hope this video is not too long. The next thing I get a lot is fever, especially in children. Fever of unknown origin. Like kids a lot of times spike these high fevers and nothing bacterial is going on with them, and we're limited in what we can do in urgent care. Ear infection, yes, a lot of kids sometimes though have no ear infection and they spike a fever. It can be a viral thing and they spike a fever. So I just have to, if the child's fever is going down with the use of Tylenol or Motrin, the fever is going down, but it's kind of going back up and it's kind of bouncing around. If the child is still eating, drinking, taking in fluids, they're not getting dehydrated, you can kind of, you know, watch the child. If the child is not eating, the child having this fever and this fever is not going away, then you want to tell the mom, the child needs to probably go to the emergency room to have more testing done that we cannot do in the urgent care space. Next thing is earache. I get a lot of earache, and a lot of earache from older adults since I've been in the urgent care space has equated to wax buildup. We do the irrigation to get the wax out. Kids, so they come in and they have earache, and sometimes it's ear infection, sometimes it's wax buildup. Sometimes they say that they feel that they have pressure in their ears. A lot of times their sinuses are draining and backing up in the ears. So, you know, it's not always an ear infection. And of course, if it's an ear infection, if it's an outer ear infection, because that's another thing, you can have an inner ear infection and you can have an outer ear infection. So otitis externa is the outer ear infection where you would just give the drops to the ears. If it's an inner ear infection where it's red and the tympanic membrane is bulging, you go ahead and give oral antibiotics. But if you just see a little bit of redness, there's no bulging, they're complaining of earache, there's no wax buildup, I just give the antibiotic ear drops because 9 times out of 10 that does the trick. Next thing that patient comes for is chest pain, y'all. It can be a muscular thing, it can be GERD, it can be a heart attack. I mean, it can be a lot of things while you're having a chest pain. So automatically, if you come into the urgent care, you ask and you say up front, I'm having chest pain, we always pull them back. We make sure we do our vitals, make sure the vitals are stable, automatically do an EKG to see what EKG shows. If the EKG looks at all abnormal to me, they're going to the emergency department, especially if they're complaining about chest pain and the pain is radiating. Patients should say, my chest hurt is radiating down my arm or something. I have had a couple of patients with chest pain though, and it was truly because of anxiety. And I have done a workup and actually sent them home. So I have sent patients home that came in that complain about chest pain. But you gotta do your due diligence. You gotta be sure that, yeah, this ain't nothing serious, because what you don't wanna do is be like, that is fine, go on home, and then people pass out. So no, you don't want to do that. The next thing I get a lot in the urgent care space is sports physical, especially like in the summertime. We do sports physical a lot. I think one day I did like 15 sports physical on these kids. Sports physical really is a basic physical. You still have to listen to heart, lungs, make sure that there's no hernia. If it's a boy, make sure you're checking the scrotum so there's no hernia. There's kind of like a list of things that you truly have to check for when you do these sports physical. Not horrible. Take a little bit of time, you have to fill out the paperwork and all of that, but I do those a lot as well. The next thing I get is dizziness. People come in and they're complaining about dizziness, and dizziness, if your patient is complaining about dizziness, make sure that you at least do an orthostatic vitals. Dizziness can mean ear infection sometimes, it can mean vertigo. Another thing, eyes. Y'all, they come to the urgent care a lot when it comes on to eye problems, like something flew into my eye, I have watery eye. So this is what I want to say. Pink eye, let's touch on that real quick, because eye redness does not always equate to pink eye. And pink eye conjunctivitis, you can either have viral conjunctivitis or bacterial conjunctivitis. But when you say conjunctivitis, people are like, oh, it's pink eye, I need antibiotics. No, it can be a viral thing, and you just have the tearing of the eye, and you can do antihistamine drops for their eyes. If they have pink eye, you know, they definitely need antibiotics eye drop for the eye. Another thing, sometimes patients scratch their cornea. We do, you know, we put the solution in the eye, numb the eye, and then we look in the eye under the fluorescent scope to make sure that there's no abrasion. They didn't scratch their cornea. If there is, I give an antibiotic eye drop if I see that there is the cornea is scratched, and I send them to the eye doctor, because I ain't the eye doctor, honey. You know, now I think that's it. Thank you guys so much for watching. Don't forget to like, comment, and subscribe to the channel. Make sure that you check out the next video right here. That is the video where I talk all about my 6 months update in the urgent care space. Bye guys.